All right, I'm here this morning with Otis Mack, and we saw him initially back in November. Your wife drug in because your arm was really hurting you. So tell the viewers a little bit about what you had going on, what it was preventing you from doing, what kind of problems you were having from it.
This arm, it was paining me to death. I had a pinched muscle, and I couldn't do anything. It was just really paining. And
you were having some numbness down into that hand even too, I think.
All down in the finger, in both of these fingers. It was really terrible.
I remember we couldn't even lay you down. We couldn't even lay you down for therapy for 2 weeks.
Right.
Because you just couldn't get in that position. So, and what we ended up finding with Mr. Mack was that he had a job previously where he had a repetitive stress kind of injury where he was pulling some wires down through something, and it created some muscle problems as well. So one of the treatments that we did use was the active release therapy, which is excellent for nerve entrapment in the arm. But the other thing that we did with you was the spinal decompression. So we couldn't get you on there for a couple weeks because you couldn't lay down.
Right.
Once we got it calmed down a little bit, we got that on there. Can you talk a little bit more about what the treatment was like?
Decompression, it really helped me out a lot. I recommend that table for anyone.
The interesting thing too, Mr. Mack, is we were getting better over time. So initially we didn't send you out for an MRI because you were improving, and now, I mean, you're pretty much. I think what you said to me a couple of visits ago was you could climb a tree backwards. Now,
I think climb a tree backwards.
I think that's a Southern thing, but that means it's good, right?
Yes.
Okay. But we actually ended up sending you out for an MRI. Just you had a little residual stuff going on, so we sent you out, and the MRI report that we went over was pretty extensive, right?
Right.
And the radiologist was really amazed that you weren't having any kind of symptoms really with that, no weakness or anything. Your wife's probably happy about that too.
Oh, yes.
Because I know she was concerned about you. So a lot of people get nervous about coming to the chiropractor. They think it's going to be, you hear spinal decompression, it just sounds kind of scary. Can you address that?
Oh, I think chiropractor is great.
Did the table hurt or the treatments hurt? Or?
Oh, no.
Okay.
No,
Excellent. And would you recommend someone who had a similar problem to seek this type of care?
I would tell them to come to a chiropractor first.
Excellent. So you don't have to go to the other doctor later.
Right.
Exactly.
Yes.
Well, Mr. Mack, I'm glad we could help you. You were a great patient. You were here when you were supposed to be, which always makes the big difference because we can't help you if you're not here, but you followed our instructions, and we got you better, and I'm glad that we could do that for you.
I am too.
Okay, great. Thank you.
Yes.